An enema can be used to treat constipation or to prepare bowel for certain procedure. Before you administer an enema, introduce yourself to the patient. Note the patient's name, the type of enema ordered, and the time of administration. Compare the record against the enema solution or packaging. If the enema is medicated, check the accuracy and completeness of the medication administration against the healthcare provider order. Identify the patient's identity. Provide privacy by closing the bedside curtain and closing the door. Open the enema packaging. Add soap solution used by your facility. Squeeze gently to mix the soap. Don clean non-sterile gloves. Ask or turn the patient on a Sims position. Drape the patient, exposing only the buttocks of the patient. Depending on the patient's mobility, place the bedpan directly beneath up against the patient's buttocks. If needed, lubricate the tip of the tubing generously. If necessary, lift the superior buttocks to expose the anus. Slowly and gently insert the tubing 7 to 10 centimeters or 3 to 4 inches to the rectum. Remove the container from the IV pole and hold it to the level of the patient's hip. Unclamp to begin instilling the solution. Slowly raise the level of the container so that it's 30 to 40 cm or 12 to 18 inches above the level of the hips. Adjust the IV pole and rehang the container. When the correct amount of solution has been instilled, clamp the tubing and slowly remove it from the rectum. If there is stool on the tubing, wrap the tubing with disposable wipes or with toilet tissue and dispose it. Clean the rectal area. Cover and instruct the patient to hold the enema solution within 5 to 15 minutes. Dispose the enema supplies or if they are usable, clean and stored in an appropriate location within the patient's room. Remove your gloves and do hand hygiene. Perform hand washing immediately after leaving the room. For pre-pack enema, perform the same step as for cleansing enema. Hand washing, gloving, position, and so on, with the following differences. Open the pre-pack enema and remove the cap of the container. Clip the tip of the container if there's no hole in it. You may need an extra lubricant even though it's pre-lubricated. To instill the solution, tilt the container slightly and slowly roll and squeeze the container until all solution is instilled. Withdraw the container tip from the rectum. Wipe the area with disposable wipe or toilet tissue. Dispose the empty container.
Slowly and gently insert the tip of the tubing approximately 7 to 10 centimeters or 3 to 4 inches into the rectum. Have your patient take